Thank you. My name is Steve Faber. I'm with the Delta Strategy. Today I've been seen but not heard. I was trying to come up with a joke that had a punchline, I'm a little hoarse, but I couldn't think of one. If anybody knows that joke, but I'm dealing a little bit with a cold, so forgive me. Thank you so much for participating in this group discussion. I hope that it provided insight. I hope it connected you to people that you didn't know before. I'm always amazed when we start this work and start thinking about who's doing what in the community, how much there is going on. When you look at the back of your community counts report card, we have a section there called community engagement, and we measure some things in there about how involved our community is in solving its problems. And we are special that way. We do have people that roll up their sleeves and get to work. And we hope that this is the start of that kind of a conversation for you, that you're exploring for yourself, how can I get involved or continue to stay involved, but also that we collectively can find ways to begin to find solutions to some of our biggest problems. We are going to ask the facilitators that were in each of these subgroups just to report out some common big themes so that the other groups have that opportunity to hear. When we were setting these apart, just to echo Suzanne's comments, these are not silo issues. They are interconnected, and at some point you got to start categorizing. We don't know that we got those categorizations right, but this is an opportunity to kind of hear how those different issues might connect. So as you had a conversation, listen to how other groups were also talking about that issue. So, anybody want to start from Julie Cowie from the health group?
Healthcare disparities. Our thought leader was Dr. Con Ned, and he gave a wonderful framework talking about crucial conversations. So that's our one of the ideas was to spend $1 million to fund the ability for the Marys of Grand Rapids to gather and have the crucial conversations around people's experiences with disparities in healthcare. A lot of comments around education. Education in the community, increased education around the various healthcare issues. Another idea was to spend the $1 million to educate a cadre of people who would then become peer educators. Each one of those, maybe you start with 20, and they educate 7 others to kind of gain momentum in a real, I think probably a credible, believable way, because we talked a lot about how the system is hard to access, even though the system may have all the services. Also educating policymakers who develop the policy around accessing health care. We talked a big idea about offering or making sure there is cultural sensitivity training for medical staff and medical systems, and this certainly goes beyond translation, beyond offering translators. An idea to develop a shared database so all the agencies that are addressing the problem are working with the same data around what the problems are. And finally, one idea to start with that, spending that $1 million in one community or neighborhood where you're making a difference in a systemic way, addressing all the issues that factor into healthcare disparity. Many other ideas besides that, but I'm going to honor the time. Yeah.
Thank you, Julie. Larry, are you reporting for the Workforce Development Career Preparation?
There were 2 aspects of our workforce development group, one dealing with career preparation, preparing youth for future jobs, and the second retraining displaced or underemployed workers. Some of the suggestions for preparing youth for future jobs was to focus on those 4th graders and assure that everyone at that 4th grade level has the appropriate level of literacy. And so an early intervention prevention focus in that area. To research best practices and look for what people anywhere are doing that's replicable and sustainable, that we might use as a model to achieve that literacy. Some indication that we experience in our community apathy. We go about our lives and we're not engaged, ignorance or lack of information, and we don't have a common vision. And so in some way or another, we need to address all three of those elements. And in developing our vision for the future, we need to do that in a way that engages people at all age levels, young people, children, as well as even people as old as me. In terms of retaining displaced or retraining displaced or underemployed workers, focusing on schools that give back and educate and train not only children and kids, but the entire community. Lots of parents don't have the job skills to help pass along to their children. They don't have them themselves. Suggestion of creating a database for resources about what's happening in our community, how to access various information. A focus on second and third generation welfare recipients and interrupting that cycle and breaking that cycle of repetition. Teaching and training soft skills as well as hard skills, anger management, problem-solving skills, and teaching people how to continually learn and relearn, because today's jobs are not going to be tomorrow's jobs, and tomorrow's jobs aren't going to be the next day's jobs. And so teaching people hard skills is a short-term focus. Teaching people skills of how to continually retrain and relearn themselves has longer-term focus.
Thank you, Larry. And Karen will report on youth development.
For our group for the youth development, a focus was on character development with subtopic areas on caring adults, so strengthening families and relationships, so some of those extended relationships that they have, the kids learning, so creating opportunities for learning, not just in schools, but outside of that, other learning opportunities, and then safe places, so creating supportive communities. A common theme for us as we closed our session was collaboration, and some of those ideas, one that really stood out, it actually came up in all three of the areas, was to create something like a strategic action plan to bring the community together on a common agreement, creating hope in the community, as well as a message of urgency. One of the things that came up was we know that other communities around us in West Michigan have their promises, looking at something like a Grand Rapids Promise, really looking at it as far as a plan for not just education but economic growth. A sub thing for that was maybe even tie funding, so we've got that $1 million, tie that funding piece to that strategic action plan so that everyone gets together, so pool our resources, have one tool of collaboration. Another idea for getting everyone together would be pooling the nonprofit and some of our community resources together, because we do have a lot of resources out there, so really just making sure that everyone is together. Again, funding being tied to the strategic plan or community strategic plan was key. And then for the safe places, we had a traditional and a non-traditional thought out there, but realistically we do have to start looking at some policy issues out there and using the money to impact policy issues.